Hi, I'm Lawrence Bergstrom, registered osteopath of over 25 years experience, a former NHS osteopath of over 10 years and an advanced trained non-surgical spinal disc decompression specialist. Now, in this video, we're going to talk a little bit about crumbling spine. We do see quite a lot of patients in our clinic that are told by somebody their spine is crumbling, and we want to discuss that a little bit because a lot of people get very frightened by this terminology. Now, the truth is, generally speaking, the good news is people don't have a crumbling spine. What we're actually seeing on medical imaging, so plain X-ray and MRI predominantly, is evidence of bony changes, degenerative changes within joints, but the bones themselves are not crumbling. And the reason this is so important to discuss is the wrong terminology can give the patient the wrong idea, and it can lead to fear and avoidance of certain activities and so on. So when we're talking about crumbling spines, or when people, we never use that term in our clinic, but when people are told about crumbling spines, invariably what we're seeing is this is a vertebrae or a bone in the spine, and this one is too. This is a section of spinal cord going through the central canal. We have peripheral nerves coming off the spinal cord, and so this is the rear of the spine here, and you can see these joints moving. Now, as the discs start to become more worn and we get more compression on these discs, it leads to more compression on the joints at the back here. Now, the law of physics dictates that energy can't be destroyed, it can only be changed from one form to another. So as we get more compression on here, we get more heat and friction developing on these joints. Now, there's a process called natural arthrodesis, where joints, when they're sufficiently worn, will actually try and fuse themselves. Now, long before they fuse, what actually happens is we start to get bony growths starting to, and bony lips starting to develop on these joints. Now, when you look at an X-ray, you will see these growths. Now, that can sort of look like the spine is crumbling, and it isn't. What's actually happening is the joint is really trying to fuse itself, because it's the only thing left for it to do, because unfortunately our bodies aren't very good at replacing cartilage. Now, a crumbling spine as such will be much more of a osteoporotic evidence on imaging. So what we would see is these bones are starting to wedge, they're starting to collapse to a degree through the honeycomb structure within the vertebrae. The little windows between these honeycombs are starting to expand and expand and expand. And as time goes on, the strength and the integrity of the joint is such that it starts to diminish. And as it diminishes, as you put more load on, ultimately it's more prone to collapse. So that would be more to be considered a crumbling spine. But medically, there's no such thing as a crumbling spine, really. There's either an osteoporotic spine or an arthritic spine. Okay, so if you've been told your spine is crumbling, it's very important that whoever sits with you is looking at your medical imaging and explaining it to you in a way that you understand, and using the correct terminology, because as I say, we see quite a lot of patients that are terrified. They're told they've got a crumbling spine by somebody, and one of the first things we like to do is to make sure that they're reassured that their spine isn't in actual fact crumbling, because of course once that gets into your head, it can have pretty terrifying consequences for a lot of people. Okay, so hopefully this little explainer video on the terminology of crumbling spine has been helpful, and it might just set your mind at rest a little bit. Okay, thank you very much for watching.